Okay, welcome back to Race, Place, and Inequality. This lecture is going to be pretty short because it's only dealing with one reading, and the reading is only a couple of pages. And also, I don't want to take away from the student lecture videos that you're going to be watching. I don't want to kind of say the same thing they're going to say, even though sometimes I kind of feel that happens. However, I also think it's good to get different perspectives of the same thing. So that's always good. But I want to just kind of give you an introduction and then allow the student lecturers to give more details about this topic. Also, your place-based research project is coming up very soon. Or the due date is coming up very soon. So I want to give you the opportunity to get that done as well. So I don't want to take up too much of your time because I know many of you are doing that project, and I know that I want to make sure I give you that time. So if you look at the first slide, see student lecture for details. Basically, if you look at the student lecture videos, see student lecture videos for details. That is where you can find more information on this topic. And I'm pretty sure, I will expect those videos to be more detailed. But I did want to talk about a few things. And then, of course, make sure that you finish your research project for next week. So with that being said, let's jump right into it. What Rashad Shabazz does, obviously he's been talking about race and space this entire time and spatializing Blackness. He does a good job of talking about it in many different ways. One in terms of residential location, then he goes into masculinity. Obviously, I think the last time we talked about it, when we were talking about gender and masculinity, we talked about mass incarceration. And so that was one of the key ways in which the production of gender identity existed through mass incarceration. And here he goes even deeper into the actual war on drugs itself, not in a way that Ava DuVernay does in 13th, which I can't remember if this was the class that I assigned. But from what I understand, probably by now you've seen 13th, either in high school or in college or something like that. But it's a very popular documentary that talks about the war on drugs and mass incarceration. Well, more mass incarceration, not really the war on drugs, but it kind of goes hand in hand. And so, but what Rashad Shabazz does is he talks about how, and I think he does a great job of it, talks about how the war on drugs and mass incarceration was the engine for spatializing the HIV and AIDS virus within Black communities. Now, that's a part of the conversation I've never heard before. And so I thought it was quite fascinating how he brought out this very, can be kind of complicated intersection of how race and HIV and AIDS and space all work together to lead to the disproportionate deaths of Black people, not just in prison, but outside of prison, at the from the HIV and AIDS virus, right? So fascinating conversation right there. And he uses this method from a researcher about a century and some change ago called Dr. John Snow. And so we'll, again, just kind of introducing you to it. I know your fellow colleagues will go into it in much deeper, in much more detail. But Chicago essentially was this great feeder into the state prison system, largely because of incarceration and because of the war on drugs. And so if you know anything about the war on drugs that happened in the early 80s, where Ronald Reagan, and if you were in my racial and ethnic minorities class, we talked about this in great detail. It started with Richard Nixon and then was expanded by Ronald Reagan, where a lot of money was pumped into federal governments and local governments and local precincts to basically look at drug users and drug dealers as the highest criminals. Our job is to get these drugs off the streets, and we're going to pump as much money, as much resources. We're going to give them military equipment to get, because this is the number one terror. These are the number one terrorists in the United States, these drug dealers and these drug users. And we want to get drugs out of our schools, out of our communities, off of the streets. This is how we're going to do it. We're going to attack drug users. We're going to hike up drug offense, drug-related crimes. So drug dealers will get way more years. Drug users will start getting way more years for using drugs, for having any drug paraphernalia, anything related to drugs. We are going to flood the prison system with criminals who are related to, in some way, drug dealing or drug using. And this happened in a lot of major cities, particularly bigger cities like Chicago. So Chicago was a great feeder into the larger state prison system. But in addition to that was this concept that Rashad Shabazz calls the geography of risk. And basically what he's saying is, along with using the war on drugs as a way of expanding the incarceration system, expanding the number of people in prisons, and then using that to feed into a state prison system that Angela Davis would later call the prison industrial complex, which is the way in which prisons use the bodies of prisoners, specifically Black bodies, as cheap labor, right, for larger industries, clothing, agriculture, highways. All of these things are built essentially by the cheap labor from prison labor, right? The cheap prison labor, right, that exists in our country. But not only that, you also have the geography of risk. So it's also about space, right? And the fact that these people who are entering the prison system are entering into a confined space, right? And so this confined space allows for what he calls the socio-spatial production of HIV infection, which means when you create this limited space for people, and then you place a whole bunch of people, or maybe even not a whole bunch of people, but a few people that are infected with this disease, and then you place them into this space, now you have created this space of two things, right? The geography of risk exists because of two factors. If you want to, you can write this down. He says, because of space, so people are segregated, right? People are segregated. Number one, in society, right? You have Black Chicago, you have white Chicago, right? And so he says, in Black Chicago, and we already know because of drug policies that Black people are going to be arrested at a higher rate than white people because of drug-related crimes. There's no research that shows that Black people do drugs at a larger rate or are related to drugs in a larger rate than white people, right? In fact, research shows that Black people and white people do deal or are related to drugs at approximately the same rate. The percentages are very similar. So the percentages are similar of Black people and white people doing drugs, selling drugs, et cetera. But the percentage of drug-related arrests for Black people are way higher than the percentage of drug-related arrests to white people. And a lot of that, and we can go into more detail, with Michelle Alexander's book, The New Jim Crow. But what Rashad Shabazz is saying is that because of the larger residential segregation in our society, because you have the Black Belt, you have Black Chicago, more police are going to go there, more police are going to police those areas, more police are going to arrest those people, and more of those people are going to be likely placed into prison than the drug-related crimes in white Chicago, right? And so you already have the segregation that's leading to the segregation, the war on drugs. So that space issue is already causing this geography of risk on the outside. Now you place that on the inside of prisons. Now you have these systemic forces of mass incarceration, right? which we know is a structural limitation. This is a structural project that was done by the state for economic reasons, right? Mass incarceration, death, right? And the increase of death because of HIV and AIDS within the prison system. And then the lack of healthcare and politics, right? Not just in the prison system, but also in Black neighborhoods. These larger systemic forces put together create what Rashad Shabazz calls a geography of risk, right? Space and systemic forces. Space being the segregation of war on drugs, the systemic forces being the mass incarceration, the high levels of death, the lack of healthcare, and the politics in Black neighborhoods. That lack of healthcare is also one of the reasons why there's a epidemiologist by the name of Pisani. It's actually one of the first studies I learned about in my PhD program. Pisani, she has a book, if you're interested in this topic, called The Wisdom of Whores. And she was the top epidemiologist that studied HIV and AIDS in the 80s and in the 90s when it was, at its height. And she talks about how the spreading of HIV and AIDS, a lot of people thought had to do with the illicit sex, right? The illicit sex, the non-marital sex that was happening between certain groups. So whatever groups were having the most sex, the most illicit sex, the most unsafe sex, this was the group that would have HIV and AIDS the most. And what she found, and that was the kind of the idea, and early on it was called the gay disease. So whichever group had the most gays in that group, particularly like whatever racial group, ethnic group, whatever, that would be the group that would have the most. And what they ended up finding out doing all this research was that the spreading of HIV and AIDS had less to do with sex, who had sex, when or how people had sex, who or how many people were gay. It had less to do with that and more to do with social class. Who had access to condoms? Who had access to healthcare that could strengthen or weaken one's ability to contract the disease. All of these were more of the factors that had to do with who or what groups were more likely to catch HIV or get infected by HIV and AIDS than other groups. So that was a really, really, really interesting study. Pisani, The Wisdom of Whores, if you're interested in that topic. And so this is kind of what Rashad Shabazz is dealing with, right? This is what he's talking about. He's saying that it's really the politics around race and really the politics around class that and how these politics create more of these space. And what he adds on that Pisani does not is the notion of space and how these things play out in where these diseases go and how trapped they are. And when they get trapped, then they can spread within that group for an unlimited amount of time. And then once it's spread, and then you let the boundaries within that place go, now it can spread to these other trapped spaces, right? We'll talk about that in a second. So what he says essentially is that prisons did not create HIV and AIDS, but it exacerbated through the space for spreading. So he talks about a couple of people that had HIV and AIDS, some of the early prisoners in Chicago that had HIV and AIDS. And what happened is a lot of the prisoners didn't, but the ones that did, it ended up spreading within that area, right? And it was able to spread in an unlimited fashion because these people were confined, because these people were spatially confined for a certain amount of time, right? A lot of people, so then the next question will be, well, how did these people contract AIDS? Did they contract it through illicit sex? What was happening? And what he finds out is that a majority of them contracted HIV and AIDS, not through sex, but through, but because they were addicts, right? So because they were addicts who contracted HIV and AIDS through dirty needles, more than likely, this put other prisoners at risk. And so then when they got into prison and they were spatially confined, and how did they become spatially confined? Through mass incarceration, through the war on drugs. So you take these drug dealers or these drug users who are more likely who are not more likely to be Black, but the Black ones are more likely to be spatially confined. And then you place them with the drug dealers who are more likely to be the victims of mass incarceration. You put them together, and then now who's going to spread these things to what? Whether it be through sex in prison or whether it be through, and a lot of people don't take into account the spreading of needles, not necessarily through drugs, right? Because a lot of these people, a lot of the drug dealers may not do drugs. They may have sold drugs, but they didn't do drugs. But what are some other ways in which people use needles in prison? Tattoos, right? So they may be in prison. Hey, I want a tattoo. They use a dirty needle, and now they're getting AIDS. Now they have HIV and AIDS, right? Through these dirty needles that they use through tattoos. So that's another way in which HIV and AIDS was spread, which is something that a lot of people don't talk about, right? They only talk about dirty needles through drugs, heroin addicts or sex, or I forgot the other one. I know it's three major ones, but I can't remember. So anyway, then he goes into ghost mapping and talks about how ghost mapping was something that was created through a brother by the name of Dr. John Snow. And if we go to page 100, 100. Let's read where it says few records. And he says few records were kept at that time about the deceased, particularly where they ate and drank. He's talking about these people. Dr. John Snow was studying why so many people were dying of cholera in I think in an area in London, if I'm not mistaken. Thousands of people had died, and they were trying to figure out why. Some people thought it was a disease that was going on through the air. And Dr. John Snow said, I don't know. I think we need to look deeper and use what he would later call ghost mapping, what would later be called ghost mapping, to really find the real source. So he says few records were kept at that time about the disease, particularly where they ate and drank. Interviews were impossible since most people who suffered from the disease were already dead. Therefore, Snow began to collect any and all information about the deceased in the hope that he could find a pattern to crack the cholera code. His approach was revolutionary. Collect information, this is key, collect information about cholera cases and match them with information about the water supply. So his discovery forever changed the face of public health and medicine. He found that the Golden Square neighborhood of poverty-stricken slum packed to the scenes with residents was at the epicenter of the outbreak. Through reading death records from local churches, Snow gained descriptive information about the deceased, age, gender, and most important, home address. This information told him where they had received their water. So what he ended up doing, which is probably the reason why it's called ghost mapping, is because he's mapping the ghosts. He's mapping these people who had passed away. Where did they come from? What area of the city were they most likely to live in? Where they may have most likely came in contact with cholera. And while other people are saying, oh, it's something in the air or something maybe in the food or whatever, he's realizing, wait a minute, they are all more than likely coming from this area. And if we look at the water supply, we see that there is a certain water supply that goes to this area that doesn't go anywhere else. Let's find out if there's something in the water. And what he ended up finding out was that this water came from a larger river or something that was polluted. And so it was more than, so when they studied it, they realized that that was where the cholera outbreak came from. So I'm pretty sure, the students probably go into a little bit more detail, but this modernized the epidemiological methods that would be used to find the source of diseases, right? The source of epidemics. So for example, even if you look at COVID-19, right? How do we know where it started? And it is this ghost mapping, when you map all of the diseases and where it came from, which countries got it first and where and who and how. And, it can, you can kind of create and find where at ground zero, where it was located. And so these are the types of approaches that have taken place because of of Dr. John Snow. And so what Rashad Shabazz does is he says, well, let's take this same approach of ghost mapping and use this to map how and where the source is for the large concentration of HIV and AIDS infections in the Black community, where that came from. If we map these infections all the way back to the early 80s, particularly in Chicago, to these first people who contracted HIV and AIDS, what will we find? And what he ends up finding is that the issue, or the reason why HIV and AIDS was so prevalent in early Black Chicago, is because of what he would say, well, he talks about intake pumps and water pumps, so you can look deeper into that. But basically, he says that it was public policy and it was mass incarceration. These are the two factors that were the cause of, just like the factors that were the cause of cholera in London in the 1850s was the water pumps, right? Going into this particular area of London. He says it was the public policies and mass incarceration that pumped, this version of cholera, HIV, and AIDS into predominantly Black communities. And so if we go and follow his details, what he ends up showing us is that, again, Black men enter prisons, and we just talked about this earlier, and as they entered prisons, HIV and AIDS followed them, right? Because you had Black men who were entering prisons at a much larger rate than white men, and the few that did enter the prisons, or the few that did enter the prisons with HIV and AIDS, would then spread the HIV and AIDS throughout, with other men in the prison. And again, most likely the people who were entering the prisons with HIV and AIDS were men who had contacted HIV and AIDS through intravenous drug usage, right? So people who use dirty needles to shoot up heroin, and these were the people that were more than likely, the drug users that were more likely in prison. So the drug dealers, if they were in prison, more than likely they didn't have HIV and AIDS or, whatever, but it was those few drug users that were there that would end up spreading it. The migration into prisons is not what caused HIV and AIDS, but allowed it to spread through the war on drugs. So the war on drugs was what he would argue was the intake pipe that moved the water, HIV and AIDS, the deadly water, HIV and AIDS, from the streets into the prisons, which was the bodies, like the bodies of cholera was the prisons, right? These are the bodies that are holding HIV and AIDS. So it was the war on drugs that was the vehicle in which HIV and AIDS was used to go into the bodies of Black men in a larger way. So for example, if there were no war on drugs, right? If you didn't have this mass incarceration system, then these gentlemen who had gotten HIV and AIDS through intravenous drug usage, the likelihood that they would have passed it on to that many people in an uninhibited space would have decreased, they say, about 14 times. 14 times. Less likely, because the likelihood of them coming into contact with those drug dealers in a way where they would exchange needles or something like that is far, 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 far less. If you have a drug user that has HIV and AIDS, they do their thing, they keep using drugs, they'll keep putting dirty needles in themselves, but the likelihood of them spreading it, or even if they spread it to a few people, it won't be as high. But you put them in a closely confined space with people that they probably would not have come in contact with had they not been in prison, and they're there for years and years and years, the likelihood of them spreading it is just extremely large, right? 14 times larger. And because the Black drug arrests, again, were greater than the white drug arrests, then the likelihood of the spreading of the disease among Black people increased immensely. The white drug arrests, even though white people are using drugs and dealing drugs at the same percentage as Black people, they're not being arrested as much, which means they're not the ones going into this confined prison system, which means if they have HIV and AIDS, it's not spreading in their community as fast as it is spreading in Black communities. So this is why this ghost mapping is actually very interesting, and what Rashad Shabazz and what he argues and what he brings out is so revolutionary, because it's showing that HIV and the spreading of HIV and AIDS has less to do with our own individual decisions, right? Not contacting it, right? Because these few people contacted it through their decision to shoot up. But why it was so easily spread is because of larger systemic forces, larger sociological forces, like federal policies, war on drugs, all these different things, right? So the war on drugs was the intake pipes that move HIV and AIDS from the streets into the prisons. And then the environment of risk stayed in the prisons. This is where the geography of risk was able to be exacerbated, moved, spread, and strengthened. He said this also disrupted the relationship through mass incarceration, right? So now the relationship between drug users and HIV and AIDS is not as, now it disrupts that, because now it's not just drug users and HIV and AIDS, it's drug users, it's HIV and AIDS, then it's non-drug users, and then it's non-drug users and their sexual partners. So, which goes into, and I don't go too deep into this, your colleagues probably will, but then he talks about how it ends up leaving the prison. Once the person has done their time, they get out of prison, they're going back into a segregated Black Chicago. What happens when these men get out of prison? They've contacted HIV and AIDS, and you're talking about the 80s, so many of them aren't getting AIDS tests. Many of them don't even think they have it because it's considered what? A gay disease. Well, I'm not gay. I didn't even sleep with any men in prison. So how can I contract HIV and AIDS? I'm good. I did 10 years. I did 15 years. I come out. I go back to my old neighborhood. I see a girl I used to sleep with. I sleep with her again. I don't think I have HIV and AIDS because I didn't have sex with any men or anything. But, oh, I did get this tattoo. But we don't know a whole lot about HIV and AIDS. I didn't use any drugs. I didn't have sex with any man. I just got this tattoo. You mean I can get AIDS through tattoo? I can get HIV and it can grow into AIDS from getting a tattoo? I didn't know that. But guess what? It goes back into segregated Black Chicago, right? Another limited, we've already talked about a limited spatially confined space. And then just like it exacerbates in prisons, it is exacerbating within the Black community. Because guess what? It's still segregated. They can still only go have jobs, have relationships, anything within that area. And then it's much more likely to spread now within a free, right? They're not in prison, but they're still imprisoned, right? Even though they're not in a prison, they're still in prison, and the disease still is more likely to spread, right? Which is why, again, the HIV and AIDS related cases racially are disproportionate. Not because Black people are using drugs more, not because they're having more illicit sex, not because they don't have sex or they have sex without condoms, none of that. It is because of the war on drugs, mass incarceration, the spreading of it at a rapid rate in prisons, and then bringing that HIV and AIDS back to our communities, but back into Black communities that are also segregated, right? It also provided a limited space for it to grow unbounded. We already talked about that. So these are the three ways in which we can see the ghost mapping of the war on drugs and how that was the intake pipe of HIV and AIDS into prisons, and then from prisons, and they'll go into more detail, into prisons back out into Black communities. And so he kind of ends this section with saying that the Illinois Department of Corrections actually pumped the disease because of the segregated opportunities of people who were formerly incarcerated because of these regulations, they are now back. These people go back into Black Chicago. They go back to their neighborhoods. They go back to their projects. They go back to their ghettos or wherever they're from, neighborhoods, and they can't go outside of that. They can't violate parole. They can't go anywhere. They can't do anything. They can try to get a job. They can work around the system as best they can. But for the most part, they can only stay within a certain area. They only have certain opportunities, and they're limited, spatially limited, mobily, socially limited. And so that disease then becomes limited as well. Very similar to the kitchenettes. We talked about that. We weren't talking about HIV and AIDS, but we were talking about diseases that were confined in these kitchenettes because you had hundreds and hundreds and hundreds of people living in these buildings, these areas, right? You had whole families living in little 1-2 bedroom apartments, maybe a suite. You had 6 families living there. Right? And so somebody gets sick. You know how that happens in your house. You get sick, then your mom gets sick, and your dad gets sick, or your brothers get sick, sister gets sick, everybody gets sick because of one person. Why? Because you're so confined. Now you multiply that times 6, 7, 8 families. Same thing with prisons. You confine people in space, that's what's going to happen. Right? So in addition to that, even now, the United States currently does not provide prisoners with clean needles because of the belief that if you give clean needles to prisoners, it'll placate the addicts, and they'll be more likely to use dirt, or they'll be more likely to use heroin. Right? They'll be more likely to use these drugs, which actually I was thinking about giving you this. I was like, I give y'all a lot of links and stuff. But what I will say is, if you're interested in this topic, there is I forgot his last name. Hold on. Let me see. Columbia professor. He's a Columbia professor, Carl something. Columbia professor, Carl Hart. Yes, that's his name. He's an American psychologist. And he's a neuroscientist, and he is a professor of psychology at Columbia University. He went viral a couple of months ago, earlier this year, because he came out with a book. What's the name of that book? Let me see. The name of his book, Drug Use for Grown-Ups. Yes, that was a big. And basically, he suggested that in order for us to really limit the spread of diseases and how people use drugs and the illicit ways in which people use drugs, was to actually provide them safe and healthy spaces for them to use drugs. Because he's saying, to keep telling people to stop using drugs, he's like, that's not going to work. We've been saying that for decades, and it's not working. And it's only getting worse and worse and worse and worse and worse. And he's saying people are going to use them. That's just what's going to happen. Drugs are here. And if they live in a society where they're stressed, they're freaking out, there's so much going on, people are going to turn to drugs. That's just what it is. People have been doing drugs for centuries. So to tell people to stop doing them, to lock people up, that's not helping. He said what we can do, and he's seen it happen in other countries, he said we should provide a safe and healthy space for people to use drugs, provide clean needles. And if we do that, we can at least make it safer so that we're not continuing to spread diseases. And anyway, people went off. And he also admitted to being a casual drug user, and not just, marijuana, or not even just cocaine. He said that he casually shoots up heroin, right? He's a casual heroin drug user, and people went completely off. I mean, people just, right? He is a professor. He's still a professor, as far as I know. He's written a lot of books. He's done groundbreaking research. He's just a casual drug user, which exists. And if we're honest, there are probably a lot of casual drug users out there functioning. They're called functioning drug addicts. And he didn't say he was an addict. He just says every once in a while, I think he said maybe once or twice a year, he may engage, right? and indulge. And so he talked about, and so he mentioned this got crazy. You know, everybody was going off. He was on Breakfast Club. He was doing all these different interviews. He was on a press run. Some people agree with him. Some people say, hey, he might have a point. Some people was like, a lot of people were like, no, this is crazy, right? I'm not gonna say what you should or shouldn't believe, but I definitely would suggest listening and seeing where he's coming from. I agree with some points that he made. I disagree with other points that he made, but I do think that he makes an interesting argument, and Rashad Shabazz does in a way as well, right? He's not necessarily saying what we should do to stop the spread of. He's kind of just presenting this information, talking about it sociologically and what has been done from the war on drugs and mass incarceration, and how that has exacerbated the issue of illicit drugs in Black communities, and particularly spreading of HIV and AIDS in confined Black spaces. But the mentioning of the fact that there is no access to clean needles for these drug addicts that are now put in confined spaces could be linked to what Carl Hart is saying. Maybe we need to provide clean needles, just like when people say, some people argue, tell young people not to have sex before marriage, right? That's obviously the abstinent way, right? People who teach abstinence say you shouldn't have sex before marriage. But then another person may say, no, young people are going to have sex. You're a teenager, you're a young adult. Most people are not waiting until marriage. They go and they have sex. So why don't we provide them condoms? Why don't we provide a safe way for them to have sex? So even though they're going to have sex, they can be safe when they do it, and they're not spreading diseases. They're not having babies out of, or they're less likely to have a child out of wedlock, blah, blah, blah. So it's kind of a similar kind of way, right? We can't stop them from doing it. Let's at least make it safe for people to do what we may not want them to do. So it's an interesting topic. It's an interesting conversation. Feel free to, reach out to me if you want to talk about it, and respond to your colleagues as you read their student or watch their student lecture videos and check those out. I think it's a very interesting read. I think Rashad Shabazz does a great job in that chapter in talking about race, space, class, and disease, and how these larger structural powers of mass incarceration and the war on drugs essentially help exacerbate it within Black communities, and particularly Black Chicago. So with that being said, I hope you have a great day, great week, great weekend. Make sure you are on top of your project. If you have any questions, you can reach out to me, and I'll see you later.